Hello, welcome to Consciously Healthy. I'm Claire.
I'm Laura.
And we're having a debate today. We're not really talking to you about anything we've got top tips about. We are going to talk to you about, really, I guess, the distinction between alternative medicine and the medical model. In fact, when we were talking about this earlier, we were like alternative versus traditional medicine, but then that's kind of a grey area too, because I would argue that traditional medicine is actually what we do, the naturopathic world, because the medical model really has only been around for, 100 or so years.
Yeah, and we brought this debate to a local British university who wanted us to come and speak to students from the alternative health model. And so, yeah, it's an interesting discussion area. We know our side of the fence a lot better than we know the medical model, even though we do hang out with doctors.
We do hang out with doctors. And so we do get a bit of their viewpoint too. And I mean, actually, even the fact that we call ourselves alternative health practitioners is kind of contentious, because most of the time people say they're complementary health therapists. And for the most part, we are quite complementary, but there are a few places where we definitely differ in our recommendations. I mean, legally, we can't differ in those recommendations if a doctor has already made a diagnosis. So, we work alongside what we have to work alongside, and gladly and freely. However, it is a really interesting debate because, I have a sort of structural issue that I've talked about before that I'm going to have surgery on. And it was interesting because for me, the surgeon said to me, well, you should really have had surgery at 15. But this is where this conversation's come from, because, at 15 I was swimming and I was playing tennis and running around and doing gymnastics and being a general 15-year-old. And there's absolutely no way my parents would have taken me to a surgeon, because I had a bit of back pain, but, my mum took me down the osteopath route or gave me some paracetamol. So it was never really an issue. So I guess really the debate is, at what point where does it stop being our responsibility and we actually, are able to go down the naturopathic route with guidance from those specialists? When do we go, okay, now I need to call in the big guns? Because what was so wonderful about the conversation I had with the surgeon was he did say, we should be the last port of call.
Yeah.
And actually the problem with the NHS now is it's not the last port of call, it's the first port of call, and therefore the NHS can't cope.
Yeah, that's a really, really interesting point. And I think this is me personally, that when I get little aches and pains, when I get things like, bladder infection, or if I got tonsillitis or got a cold or whatever, the first port of call I would be thinking alternative health. But anything that was starting to get a little bit more serious, things that don't go away, that have been treated through natural methods and don't go away, that's when I'd be thinking.
Or even things that, if someone doesn't use the alternative methods, but they have gone down, the over-the-counter methods. So I know a friend of mine whose father was eating like antacids, Rennie or whatever they're called, till the cows came home. He was just eating them, and it just, his heartburn wasn't going away. Finally, after months, went to the doctor, turned out to be, a heart condition, and he needed to have stents. And
wow.
That's really serious, right?
Yeah.
And it's a really interesting part of conversation, because even if someone like that had come to us, we would have gone down the alternative route, and we may well have, I don't know, I can't promise this, but we may well have been able to affect some good change. But whether or not we could actually, I think stents are actually, collapsing arteries, whether or not we could change that in the time frame required to stop it being a problem, I don't know.
I think it's really wonderful to celebrate our differences when it comes to alternative medicine and the medical model. And one thing that we are very, very clear on is that as alternative health practitioners, we do not diagnose.
No.
We cannot do it. We can find imbalances in the body, and we can address those imbalances, but at no point we can actually say that this is an illness or a disease. And so,
we don't have the testing methods.
No, not at all.
And it's not what we do. And I actually quite like that that's not what we do. It's a huge responsibility, and I offer that up to the doctors.
Yeah, absolutely. And so when someone wants to get clarity around what's going on in their bodies, I mean, the medical model is fantastic with its diagnostic equipment.
They've got some good tools.
Yeah, as do we. Just different.
And there are places that the medical model fall down because, for example, with my fascinating hormone journey, I was having blood tests till I was blue in the face, and they kept, literally, because they were draining all my blood, but they were all coming back as, well, no, you've got cortisol showing in your blood, there's nothing untowards. But when I saw a doctor who actually works from an alternative perspective, and he got me doing a test from a different place, a functional diagnostic test, he was able to say to me, well, yeah, you have cortisol, that's what the blood test is showing, and you have the right amount in your blood. But the saliva test, the 24-hour saliva test, showing that your body doesn't know what to do with it. Well, the doctors don't use those tests. They don't have access to those tests. And often it's because of cost. It's because of the time it takes to do them. Because of patient responsibility. So a lot of the time with the NHS, they're taking the control out of the patient's hands because, some of the stuff, it's just, I don't even know the ins and outs. So there's some really interesting points, but I also remember the story of a friend of ours whose partner, she said she felt really unwell and she was due to be going away. She was young, mid-20s, and felt quite cold, said, I just don't really feel well enough to go away. It was her birthday weekend, and ended up just feeling so unwell. She went to see a healer, a natural, an energy healer, a Reiki practitioner, who apparently tuned into her energy and said, I need you to go to A&E and I need you to go now. And she actually went into A&E and something like 10 in the morning, and she never came out. She actually died of multi-organ failure.
Wow.
And for me, I was just starting my training at this point, and it was a really humbling experience because, we can get so kind of, my therapy is fantastic and it does this and this and this. And actually it reminded me that there are always times. And so it has become something I do recommend people see doctors quite regularly if they get heart palpitations, or my first port of call is always, please get this checked out with your doctor. Reoccurring headaches, please get it checked out. I'd love to work with you, and please get it checked out with your doctor as well.
Yeah, well, the two can go hand in hand. So it's particularly, if someone's got a hormone imbalance, maybe they're on some kind of medication for the hormone imbalance, and I say we can absolutely support the body naturally. I always recommend that they continue to get their medication levels checked out, because when you start supporting the body naturally, things can change.
Yeah, exactly.
And so this is not about, us and them. Don't go and see them, come and see us. That is not our approach at all.
No.
It's much more holistic than that.
And actually something else that we've been working with is there are places that the medical model don't have anything. So they have very little for IBS. Actually, there's a couple of those kind of chronic conditions where they're just ongoing but functional. They don't really cause any major life issues apart from pain and discomfort and a bit of bloating. They're not life-threatening, that they don't often have stuff for. So we actually created our IBS protocol because there isn't much for IBS, and the medical model know that there isn't much, and they know that there are better ways to deal with it, actually, from a holistic perspective.
Yeah, I remember when we went and did a presentation in front of a bunch of gastroenterologists here in the UK, and they said how wonderful it is to have something for IBS, and they would love to be able to recommend us to these patients so that it would clear some room in their waiting room for patients that they could really treat.
That's the thing, patients that really need that last port of call. So the inflammatory bowel conditions, Crohn's disease, and cancers, and all of that kind of stuff. So it's really just, at which point do we need alternative, and at which point do we need the medical approach? And I guess for me it's always, and when do we need both? Because they can go hand in hand, and it doesn't always have to be an alternative. But I guess my top tip, if I was going to have one, is actually always get things checked out with your doctor, because the worst case scenario is there's something that's going on. Therefore, you're armed and you have information, which means you can still often work with a naturopathic doctor alongside the medical doctors. Or they say there's nothing going on, and that actually then gives your alternative practitioner a bit more of a carte blanche.
Yeah, and I think my top tip would be watch out for practitioners who say that they can heal and cure everything.
Yeah.
Number one, they shouldn't be using the word heal and cure, because we don't know if we can. I mean, the body is...
We're not allowed to make those claims.
Not at all.
And neither do doctors. Actually, doctors cannot promise to heal or cure anything.
No, not at all. Just really questioning this if you're going down the health journey, and not sort of... I know for, like, this week, I pulled my neck out, and I've been on ibuprofen to try and get, because I've been having my muscles readjusted and my spine readjusted, and to calm the muscles down.
There's
actually
a time and a place.
down the medical model has absolutely served me. And back 10 years ago, I would never have said that.
No.
I was very anti the medical model, but I've really learned to...
There's a time and a place.
I completely agree.
Absolutely. So, and my final point on that is, actually the way that the medical model look at things is to get people out of disease. The way that we are looking at the body is about taking it into optimum wellness. So when you start looking at it in those sort of spectrums, there you've got, a real opportunity to work with that. Well, thank you.
Nice conclusion.
So subscribe, please share, and please rate and review us, and feedback. Join us on Facebook. Look for balancewellness.co.uk, and we'll see you next time.
Bye.